Hey there guys, are you tired of dealing with those pesky diabetic wounds that just won't seem to heal? Well, you're in luck, because today we're going to talk about some natural remedies that can help you get back on track and kick those wounds to the curb. Diabetic wounds can be a real pain in the well-you-know-where. But don't worry, we at Diabetes Health have got your back. We'll give you the lowdown on why these wounds occur and, most importantly, some natural solutions to help speed up the healing process. So sit back, relax, and get ready to learn some tips and tricks for healing diabetic wounds naturally. Let's get started, and don't forget to smash the subscribe button right about now. Diabetic wounds are injuries or ulcers that occur in people with diabetes. They usually develop on the feet but can also occur in other parts of the body. Diabetes affects blood circulation and can damage nerves, which makes it harder for wounds to heal. High blood sugar levels can also lead to a weakened immune system, which makes it harder for the body to fight off infections. Diabetes can negatively impact wound healing due to several factors. High blood sugar levels. This can damage blood vessels and nerves, impairing blood flow and sensation, which may result in inadequate oxygen and nutrient supply for proper wound healing. Nerve damage can also make it harder to detect and treat wounds promptly. Reduced immune function. Diabetes can weaken the immune system, making it harder to fight infections and increasing the susceptibility of diabetic wounds to bacterial infections, which can delay healing. Peripheral artery disease. Diabetics are more prone to this condition, which can reduce blood flow to the legs and feet, leading to slower healing of wounds in these areas. Neuropathy. Diabetic neuropathy can cause numbness or tingling in the feet and legs, making it difficult to detect and treat wounds, leading to infection and delayed healing. Poor circulation. Diabetes-related blood vessel damage can reduce blood flow, slowing the healing process and increasing the risk of infection. Now, in addition to conventional treatments, some natural remedies may also help heal diabetic wounds by reducing inflammation, promoting blood flow, fighting infection, and stimulating tissue growth. Some of these natural remedies that you can incorporate are as follows. Aloe vera. Aloe vera is a succulent plant that has been used for centuries to treat various skin conditions, including burns, cuts, and wounds. Aloe vera gel contains polysaccharides, vitamins, minerals, and antioxidants that can help soothe and heal diabetic wounds. Aloe vera gel can also increase blood circulation and oxygen supply to the wound, which can speed up the healing process. To use aloe vera as a natural remedy for diabetic wounds, apply fresh aloe vera gel to the wound and cover it with a sterile dressing. Change the dressing and reapply aloe vera gel every day until the wound heals. Coconut oil. Coconut oil is a natural moisturizer that can help keep the wound clean and hydrated. It also has anti-inflammatory and antimicrobial properties that can prevent infection and reduce swelling. To use coconut oil for diabetic wounds, apply a thin layer of virgin coconut oil on the wound and cover it with a sterile bandage. Change the dressing daily and wash the wound with soap and water before applying new oil. Turmeric. Turmeric is a spice that has been used for centuries in traditional medicine for its anti-inflammatory, antioxidant, and antibacterial effects. It can help reduce pain, inflammation, and infection in diabetic wounds. It can also stimulate collagen production and wound contraction, which are essential for healing. To use turmeric for diabetic wounds, mix 1 teaspoon of turmeric powder with enough water to make a paste. Apply the paste on the wound and cover it with a gauze or cloth. Leave it on for a few hours or overnight and then rinse it off with warm water. Repeat this daily until the wound heals. Honey. Honey is another natural substance that has been used for wound healing since ancient times. It has antibacterial, anti-inflammatory, and antioxidant properties that can prevent infection, reduce inflammation, and promote tissue regeneration. It can also create a moist environment that facilitates healing and prevents scarring. To use honey for diabetic wounds, apply pure honey on the wound and cover it with a sterile dressing. Change the dressing every 12 to 24 hours and clean the wound with saline solution before applying new honey. Tips and precautions for treating diabetic wounds. Before using any natural remedy for diabetic wounds, it is important to consult your doctor and follow their advice. Some tips and precautions for using natural remedies are: always clean the wound with soap and water or saline solution before applying any natural remedy. Always use sterile dressings or bandages to cover the wound after applying any natural remedy. Always change the dressing or bandage daily or as directed by your doctor. Always monitor the wound for signs of infection, such as redness, swelling, pus, fever, or increased pain. Always seek medical attention if the wound does not heal within a few weeks or if you notice any signs of infection or complications. Always avoid using any natural remedy that you are allergic to or that may interact with your medications or medical conditions. Always inform your doctor about any natural remedy that you are using or planning to use for diabetic wounds. Thank you for watching this video on healing diabetic wounds naturally. We at Diabetes Health hope you found this information helpful and informative. If you or a loved one is struggling with diabetic wounds, it's important to seek medical advice and follow the recommended treatment plan. If you enjoyed this video, please give it a thumbs up and subscribe to our channel for more helpful tips and information on managing diabetes. Also, please share this video with anyone you know who might benefit from this information. Thank you again for watching, and we'll see you in the next video from Diabetes Health.